thank you very much for having me. And in particular, I would like to talk about the challenge of delayed and missed diagnosis of cancer in the cohort that I'm going to describe. Childhood cancer is becoming an important cause of morbidity and mortality in children, and especially in the developing world, where basically out of the 400,000 children that are estimated to develop cancer worldwide, actually more than 80% live in the low and middle income countries. And Africa is home to 1 out of every 4 children that develop cancer worldwide. And in Uganda, my country, we experience about 3,000 incidents of childhood cancer every year. And there are great disparities in the outcomes of childhood cancer worldwide, where much as 80% of children with cancer in the high-income countries cure, only 20% in the developing world actually do cure, which is really a very serious problem. And the reasons for poor outcomes among children in the developing world are really many. But one of them is delayed presentation, where children basically take delayed to present for treatment, diagnosis and treatment, usually with advanced disease that is not amenable to treatment. And that constitutes the diagnostic delay. And the diagnostic delay is that time between when patients start experiencing symptoms to when a diagnosis is made. And usually that is divided into either the patient delay, which is usually the time between the time the patient develops symptoms to when they contact the first physician or first health worker, and also the time, and then the physician delays from that time to actually when a cancer diagnosis is made. And this becomes a problem because childhood cancer presents with acute and subacute symptoms that progress very, very fast. Unlike adult cancer, really, childhood cancer is an acute and subacute condition, and children will develop into advanced stage disease or death if diagnosis is not made in a very, very small window of time. And unfortunately, these symptoms that patients present with cancer in children, they mimic a lot of childhood symptoms of childhood infections, which are really common in Africa, more common in Africa. And so they cause a lot of diagnostic confusion, leading into either significantly delayed diagnosis or actually misdiagnosis completely. So that children present very late for diagnosis, or they actually never present at all and die in the process of seeking care. And so therefore, early recognition and treatment is extremely important. It's actually the only way that can actually control cancer in children, because there's no screening. Unlike adult cancer, there's no screening or prevention of cancer in children. So the only way you can actually prevent children from dying of cancer is actually identifying them in time and treating them appropriately. And unfortunately, children go through the referral system, which is really basically how children are referred in Uganda and most developing countries. They're basically referred from one level of healthcare to another, to another, to another. Most of the time, which those levels are really not able to diagnose cancer, but also which actually delays the diagnosis. Or actually, what actually happens is that children oscillate between medical, spiritual, and traditional care. And that even just makes the whole situation very, very difficult. And most of the time, by the time children reach a place where their cancer can be diagnosed, it's actually too late most of the time, and a lot of children die in the process, like I said. What actually would work for children with cancer is a direct referral system, where wherever the child is identified from, whatever level the child is identified from, they can actually be directly referred to a center that has the capacity to diagnose and treat their cancer. And that's actually the only way we can actually get control of cancer in the developing world. And so in Uganda, as I said, we experience more than 2,000 incidents of cancer, childhood cancer every year, but only about 1,000 of those children are diagnosed in the 4 treatment centers in the country. And at our center, we admit about 110 patients per year, when actually we expect, from the epidemiology of cancer that has been published by Global Can, we expect about 400 incidents of cancer in our catchment area around our hospital. And so we did a study, and the objectives of this study was to describe the patient, disease, and treatment outcomes, characteristics of children that had been admitted at our center, Mbarara Regional Hospital, over the last 3 years. And we aimed especially to estimate the average time to presentation of cancer from the onset of symptoms. And we hope that this will guide a data repository for prospective studies in the future, and further research, support further research to understand barriers to early diagnosis, and hopefully aid in formulation of interventions that can improve diagnostic, early diagnosis in children. And so I did a retrospective chart review earlier this year, and of children less than 18 years who have been diagnosed with cancer over the past 3 years. And we use different descriptive statistic methods and Kaplan-Meier curves to assess basically simple patient outcomes. I think the most important thing about this is that most children presented with either swellings or anemia. And generally, that is really how cancer really generally presents in children. So the children have a swelling or a lump somewhere, and they basically tend to present with anemia, because leukemia causes anemia, and all the other cancers cause a swelling or a lump somewhere. And we actually found that it takes about 3 months between the onset of, an average of 3 months, between the onset of symptoms to when actually the child is finally presents to our center for diagnosis. And as you can see, that most of the time, shortly after they're presented, actually the diagnosis is made and treatment starts in a very, very short time. So the problem is actually the time that children can take to actually present at our center for treatment and for diagnosis. And we found that Wilms tumor, also called nephroblastoma, and Burkitt lymphoma, and acute lymphoblastic leukemia were the commonest cancers that we diagnose at our center. And these are really outcomes of children with cancer at our center. And you can see that a lot of children still die during treatment, and a lot of children also still abandon treatment, which is which is a very, very big problem. And overall, I think I'm looking for a point. Oh, yes, overall, this curve shows the survival of the whole cohort, and we can see that in about 3 years, we have about 40% of the children still alive overall. And that ranges from acute lymphoblastic leukemia, which actually has the lowest survival, to Hodgkin lymphoma, which is generally a very curable disease, generally speaking. And so our main observation was that it takes about an average of 3 months from onset of symptoms to presentation of cancer at our centers, or presentation of children at our center, and that Wilms tumor, Burkitt lymphoma, and acute lymphoblastic leukemia, the commonest cancers, that overall there's really, generally there's low overall survival apart from Hodgkin lymphoma, and there's still high treatment abandonment rates in our setting. And we hope that we can support the Pediatric Cancer Unit to conduct further research to understand this problem, where we're actually able to describe the patient and caregiver experience from the onset of symptoms to actually when they receive treatment. And also, we can look at caregiver and health system-related delays to diagnosis, and also hopefully develop an algorithm to support early recognition of cancer and appropriate referral. And hopefully we can contribute to improving childhood cancer outcomes, not only in Uganda, but generally in the developing world. And we can restore the smiles of children. That is Isaac. He had just completed the battle against stage 3 bucket lymphoma. And we can restore him to a smile together with his father in the background when we've been able to take care of these challenges that affect children in the developing world. Thank you very, very much, and especially the people who supported me in this. Thank you so much.